This week on Newsnight, a look at what the Big Beautiful Bill Act could mean for Florida's Medicaid program, its enrollees and local hospitals. Plus, new state figures show a 6% increase in the number of A-rated schools in Florida. Newsnight starts now. Hello, I'm Steve Mort. Welcome to Newsnight, where we take an in-depth look at the top stories and issues in Central Florida and how they shape our community. First tonight, the sweeping new tax and spending bill signed into law by President Trump earlier this month. The One Big Beautiful Bill Act is poised to reshape Medicaid, with hundreds of billions of dollars in cuts over a decade. The Congressional Budget Office estimates nearly 12 million people will become uninsured as a result. Florida never expanded Medicaid under the Affordable Care Act, but still faces complex challenges, with more than 4 million enrollees. Hospitals are also bracing for funding losses. Total Medicaid spending in Florida tops $30 million a year. Around two-thirds of that money comes from the federal government. I spoke earlier this week with Megan Bowman, part of the Your Florida team at WUSF, a public media reporting project focused on state governments.
It's going to have a very big impact on Floridians because this bill stands to slash about $800 billion from the federal contributions over the next decade.
Florida's not a Medicaid expansion state, of course. A lot of states have really leaned into expanding Medicaid to sort of close some of those coverage gaps. Does that mean that the impact of the Big Beautiful Bill might be less in Florida when it comes to Medicaid than in other places?
So yes, Florida is not an expansion state, and there are certain things that will impact those states who have expansion a little differently. Here in the Sunshine State, those rollbacks for Medicaid could be devastating to hospitals and clinics in rural and underserved areas. That's because these institutions typically really rely on Medicaid reimbursements for their operations. And whether you have private insurance or not, you may feel the impacts, especially if your local hospital closes and then you're expected to travel 3 hours for care. So that's especially prevalent in mothers and babies and your labor and delivery units. That could really pose a risk for your, pregnant women who if you're in labor and there's no labor and delivery service available and you have to travel 3 hours to get there, that causes a huge risk.
What about seniors, Megan? I mean, is there an impact there for coverage that people rely on as they get into their older years?
Absolutely. Medicaid also pays for a majority of seniors in nursing homes, and it's also one of the primary payers for long-term care. So care for nursing home residents takes in about 58%. So that's over half of Florida's medical dollars that they get. So that would have a huge impact for our older community and our seniors who rely on that.
Just finally, I wanted to ask about the potential impact for the state here. You reported from your analysis the numbers about two-thirds of Florida's Medicaid spend comes from federal dollars. What is the impact potentially for state coffers when this sort of all comes down the pike as implemented?
Well, I think that's the big question. So will Florida put up those dollars to kind of fill that gap? The state hasn't said whether they will or not. If we're looking at, say, SNAP, the Supplemental Nutrition Assistance Program, typically the state has not picked up federal dollars sitting there on the table, right? So are they going to pick up that gap to fund that money that, they'll lose from those Medicaid cuts? It's a waiting game, I guess. We'll see.
The state also has some restrictions on how it can raise money, right, to sort of meet that shortfall.
There were regulations put into effect with this bill that makes it more difficult for the state to raise money. And that's by putting a cap on what's called provider taxes. So those provider taxes are from nursing homes and hospitals. That money then goes into that. So those provider taxes have funded a lot of it, but with that cap, that limits how much they can raise.
Megan Bowman from WUSF there in Tampa. Well, let's bring in our panel now to break it all down. Joining us in the studio this week, Giovanni Diaz, reporter for WFTV Channel 9. Good to see you, Giovanni.
Thanks for having me.
Thanks so much for coming back on the show. Really appreciate it. Beth Kasser, regular of the program from the Winter Park Voice. Good to see you, Beth.
Thanks for having me.
And Joe Mario Pedersen covers healthcare at Central Florida Public Media. Good to see you, Joe Mario.
Always happy to be here.
Well, because this is your beat, let's start with you. You've looked
Sure.
into the issue of cuts to Medicaid. What have you found that this might mean for Florida? And what should people know about these changes?
So I think one of the big things that they should know is how much Florida was spending as far as Medicaid goes, right? So $34 billion Florida was spending. 2/3 of that was provided by the federal government.
Yeah.
So Florida was roughly spending about $10 to $12 billion. So Florida's going to have to make up the rest of that somehow. So what we can expect from that, Medicaid payments roughly to rise between 9% and 18%. Where that's leading to ultimately is probably a future where we see more uninsured people. I've seen different figures on this. One of the more prevalent figures that I've seen is in the next 10 years, we will probably see 2.4 million people uninsured as a result of this bill. There's a lot of other things that go into this. I know that we'll probably be talking about the effects on rural hospitals, who will be taking a big hit from this as well.
Yeah, I mean, in terms of the Medicaid coverage gap that you referred to there, Florida didn't, as I said earlier, didn't expand Medicaid before. I wonder if that gap could increase, though.
Yeah, that's something that we are all concerned about, right? Because here's the thing. We understand that, as you mentioned, Florida did not expand that coverage, and also a lot of people don't qualify for the Affordable Care Act in Florida. So there's a massive gap there. So a lot of people could still lose qualify for that, for Medicaid
Getting
in
that
Florida.
coverage, what do you think?
If I could jump in there, you're absolutely right that we will probably see that increase, that gap. I think one thing to really take into consideration, though, is the fact that that gap already is bigger than we probably realize. And that's before these effects go into play, right? And what I'm referring to there is between 2023 and 2024, Florida, just like the rest of the country, went through a Medicaid redetermination period. And what that means is they reviewed everybody's Medicaid and took a look at who was still eligible.
Correct.
Following the pandemic, exactly. And what happened was over 1 million people were terminated from coverage. And something important to remember there is about 500,000 of those people were children. A number I really want you to hang on to here is 80,000 children moved over to the state's CHIP, the Children's Health Insurance Program, right? 420,000 of those kids, we don't know what happened to them. The state did not track that. It's possible that they moved over into private insurance because their family members got new jobs, but what's very likely is that a large portion of that number probably is uninsured and they don't know it.
Well, that's patients. What about the healthcare industry, the medical industry itself? KFF Health News actually estimates that Medicaid accounts for nearly 1/5 of all hospital spending. That's nationwide, presumably similar in Florida. I mean, could we see an effect on hospitals in Florida? We have rural hospitals here.
We do. And yes, I mean, there will absolutely be effects here in Florida and across the country. The outlook, if you're in the healthcare business right now, is pretty bleak because this does make up, as Joe Mario said, a large percentage of payers, right? So healthcare lobbyists have traditionally been really successful when it comes to pushing for policies that help keep hospitals alive and
this
afloat.
is kind of uncharted territory, isn't it, for the
It
medical
absolutely
industry?
is. This is not an industry that is used to not getting their way. So this will be very interesting to see what happens because this is typically a very powerful lobby when you think of hospitals, insurance companies, doctors groups, all the players that make up healthcare coming together, and they're usually in unison. And we will see hospitals close as a result of this. Right now, what we're seeing discussed most is hospitals in the rural areas. There are some in Florida. And if you take out a big portion of their payer mix, these are hospitals that don't have as many private pay folks, insured people, that leaves them in a huge bind.
Yeah, what are you hearing about the hospitals Joe Mario?
I mean, just like Beth said, it's the rural hospitals in particular that are going to take a big hit from this. I've seen different estimates here in Florida as far as what they're predicting that might look like as far as closures go, right? At least 10 that are threatened of closure, right? And 2 that are facing extreme likelihood of closure. Those numbers are not hard figures, right? But what is crystal clear is exactly what Beth said. Hospitals are going to close in the next 10 years.
And let's be clear that it will start with the rural hospitals.
Right.
But this is not just about providing health care. Let's also consider what hospitals mean for local jobs. In the city I cover, Winter Park, Advent Health is the largest employer.
Yep.
So, and that
They
is
are
the
massive
case.
employers, aren't they?
Right, and that is the case across Florida as well, no matter which hospital system is dominating.
And let's remember also that Florida already is not the greatest when it comes to healthcare coverage around the country, because according to this study that was published just last year from Wallet Hub, 2024, Florida was at number 42 in a country that we have 50 states. So
Yes.
it's very low already. In that study that they published last year, they were looking into the availability of hospitals, as you mentioned. They looked into the number of patients per nurses and healthcare providers. So we are already in a bad position, and it could get worse as the time goes on.
It's a great point. In the last 10 years, we've already had 5 hospitals close down, creating these healthcare shortages throughout the state. And like those shortages exist in so many different ways, right? We have mental health care shortages, dental shortages, OBGYN shortages.
Yeah.
The state is already, as you pointed out, in a bad spot when it comes to healthcare.
I guess some of this is medium to longer term impacts. I mean, I wonder if we could see impacts, say, on hospitals to access to people's coverage in the near term, or is this something people are going to have to wait for a while to see the impacts of?
That's a really good question. As far as there's no clear-cut answer from what I've seen on that. We can probably start seeing the effects of this as early as next year. I've seen some studies say that hospitals will probably start feeling the effects of this come 2028, but the full effects will be by about 2034.
At the same time as all of this is happening, there is another push in Florida, right, to get Medicaid expansion on the ballot, I guess in lieu of legislative action from lawmakers. WFTV has covered that effort. What do we know about who's behind it?
So Florida Decides Healthcare, a group, they are the ones that are championing this initiative. They're trying to get that into the next year, into November of last year's ballot. Sorry, November next year's ballot.
Next year, yeah. We got a while yet.
Yeah, I know, right? So the plan here is try to get that debate to go into the ballot, and then folks could vote on that, and eventually we would have to expand the coverage for Medicaid across Florida. But this is a very long shot, because we're talking about more than a year from now, and also expecting that people are going to vote for it in favor of that. And we have seen over and over again that Florida kind of aligns with the national discourse when it comes to funds and healthcare and all of those debates regarding immigration and all of that. So I don't see that going through, but that's the point here. That's the initiative that we are talking about.
I want to talk a little bit about Planned Parenthood for a minute. The group recently announced it would merge its clinics in Florida amid Medicaid funding threats and the state's 6-week abortion ban. Although Florida law has long barred Medicaid from covering abortion, a provision in the Big Beautiful Bill Act blocks funding for Planned Parenthood. A judge put a temporary stay on enforcing that part of the law, but the organization says the legislation could jeopardize other services for Medicaid patients at its facilities. Michelle Casada from Planned Parenthood of Florida says it could leave many people without health services.
This is a rapidly changing situation. We continue to explore ways that we can continue to help these patients. In other areas of the country, there are Medicaid expansions in states where there are way more Medicaid patients that depend on Planned Parenthood health centers. In Florida, there are thousands of patients that depend on Planned Parenthood for life-saving cancer screenings, for STI testing, for birth control. And those are all services that they would not be able to access if this care goes away for the Medicaid participation.
Michelle Casada there from Planned Parenthood of Florida. Joe Mario, you've covered this Planned Parenthood merger. Let's talk about that first.
Sure.
What does that look like? Why does the organization say it was necessary to do that?
So one thing to get off the table as soon as possible is the CEO wanted to make very clear that this was a plan that was in the works for about a year and a half now. As far as the timing goes, it just kind of happens to line up with the president's signature of the Big Beautiful Bill, right? But they did see it as something that was necessary as a way of kind of consolidating their services, unifying the services that they offer. So, for example, one chapter would offer prenatal services up to 14 weeks, whereas the other chapter did not, right? So this was a way of creating a unification with these 17 clinics within the state. It was also a way of creating more business within their days of operation, their hours of operation, the availability of telehealth appointments, having more of that.
Which is important to people in rural areas, of course.
Very much so. And it's something that you pointed out, as far as that 1-year ban of Medicaid reimbursements toward nonprofit healthcare centers, Planned Parenthood, of course. This is supposed to affect a huge portion of the clinics available in the country. I've seen one estimate that says that it might close down 200 clinics. And speaking to the CEO, they're predicting with this merger that they don't suspect that in the next year or so, any of its 17 clinics to close down. So they are expecting to kind of hold the line, right? While this goes on.
Well, an awful lot to follow over the near, medium and long term when it comes to healthcare. For sure, you can find a link to an in-depth analysis of the Medicaid provisions in the new law from KFF Health News on our website. You'll also find a link to the full text of the One Big Beautiful Bill Act there as well, and my interview with Megan Bowman from WUSF. It's all at wcf.org/Newsnight. Okay, Florida's latest school grades are out, with 28 districts earning A ratings, including many in Central Florida. And according to its own metrics, the state says the number of A-rated schools is up 6%. Orange County School Superintendent Maria Vasquez says the district has been helped by a new statewide system for assessing students, which, instead of using a single test at the end of the year, includes multiple assessments throughout.
We're an A district. We have seen increases in almost every one of the categories thanks to the incredible work of our teachers and our support staff, our students and our families. But I do think it is a reflection of the work that's taking place, because we have seen not only growth, but we've also seen increases in proficiency. I also want to say that the new assessment system that the state of Florida put into place has helped us tremendously to be able to identify much sooner if a child is struggling, so that we can then intervene and provide the necessary supports so that the child can do better. And I think there isn't enough conversation around what the impact of the new assessment has had on the scores, because now you have a snapshot at the beginning of the year, you have a snapshot in the middle of the year, parents have access to that, and so they too can work in partnership with us to help their child overcome some of those deficit areas or the areas that they have not yet mastered.
Maria Vasquez, Superintendent of Orange County Public Schools. Beth, let me start with you on this one. I mean, the state has hailed these A grades for the districts and schools. Students, according to the state, that their reading and math scores are also improving. But the data does show struggles do continue, right?
Oh, absolutely. There were some surprises in this year's round of grades, and there are also some pretty serious questions being raised about how much of these grades are a sales job put out by the state of Florida, and how much do they truly reflect the state of the schools, because this is not supposed to be a participation trophy. Florida's school accountability system was never designed for that. We should be able to have faith when we look at these scores that they truly represent what's going on in the schools. And there have been so many changes, there's a lot of questions about that right now. Also, when you look at the funding situation for schools, for example, the Orlando Sentinel had a great story about Brookshire Elementary in Winter Park. Yep. Their grade dropped to a C. That was a surprise to a lot of parents and people in the community. And one of the things the story discovered is that fewer kids are qualifying for that extra reading help. And that's purely a funding issue. They don't have enough staff to do it. So there are some concerns, and this is all a really worthwhile conversation to be having.
Yeah, that funding question again. I mean, the legislature had actually attempted to change the way how those grades are given out by the state.
Yeah, that's right. I believe you're referring to the SCORE Act here, which shifts the percentage in which you qualified for an A to 90%, right? So I guess making it more equivalent to how the rest of us were judged and graded on getting A's.
Yeah, at the moment I think you can get 60-something%.
Yeah, there's a pretty wide threshold.
Yeah, WFTV's been covering a story of a couple of schools, like Beth mentioned, that didn't fare as well in the most recent assessments. What have your colleagues been finding?
Yeah, so here's the thing. There were three schools actually in Orange County that got a letter F as a grade, as a score, but two of them are actually working to adjust that because those two schools were schools that have special education. So one of them offers services to teen moms and to even like they take care of their children also as they go to school. So they are trying to work on changing that letter for them as well. And also there's another school that offers special education for students with disabilities. So they're actually in touch with.
So they're trying to appeal those grades?
They're trying to change that, yes. They're trying to fix that.
There are a lot of variables, though, aren't there, when it comes to education in Florida in recent years. I mean, a lot of the new state laws that we've talked about extensively here on the program, a lot of things for teachers to navigate all the education losses after COVID. It's a tough time in education.
Oh, it's a really hard time for teachers out there. COVID is still having a lingering effect on kids, especially in math and reading. I think some of these test scores are showing that. There are kids where their entire 5th grade and entry into middle school, were lost. That's a really critical time. And in addition to some of the changes we've seen that could probably be categorized more in the culture war area, we've seen a lot of fights over what books should be banned and taken out of libraries. We've seen a lot of fights about gender and how much that can be talked about in schools, things that, really don't focus on core education policy at all.
All kinds of things to keep an eye on in the education space. Be sure to catch my full in-depth interview with Orange County School Superintendent Maria Vasquez on a special edition of Newsnight Conversations, Friday evening, August 8th at 8:30 here on WCF. Meanwhile, you can find a link to the state's data on school accountability to read for yourself, alongside data from the federal government's National Assessment of Educational Progress. It's all on our website, wcf.org/Newsnight. Okay, finally tonight, former Congresswoman Stephanie Murphy is making a political comeback, launching a bid for Orange County Mayor in 2026. The Winter Park Democrat became the first Vietnamese American elected to Congress and served on the January 6th Select Committee. The race for Orange County Mayor is attracting a crowded field with big issues like growth, housing and public safety on the table. I'm going to come to you first on this one, Giovanni. What did Stephanie Murphy highlight as her sort of key priorities when she made her announcement?
So she made reference to a slew of very interesting topics, but I actually, three of them, key three topics were the ones that caught my attention the most. I selected them here. She mentioned three things. One, she talked about traffic in Orange County, which is something that we can all relate to because traffic is a little bit chaotic here. She vowed to invest in more mass transportation, which is something that really we know Central Florida and Orange County really lacks. So we need some of that. It was very interesting to see that she addressed that right away. She talked about affordable housing. She said that there's a lot of people who are moving out of Orange County in hopes to be able to afford a home. So she wants to address that, and she mentioned working on rezoning. She said that she's going to try to fight regulations to improve the number of homes available, affordable homes available for the community. And she also talked about diversifying our economy. She says she's not going to move away from tourism, but she would like to diversify and have more industries that we could invest on as a county.
Yeah, certainly there are a lot of hot button issues there. I mean, Murphy's district includes Winter Park, of course, which you cover, Beth. And I'm wondering from, your observations of her over the years, what you make of her political experience, what she brings to that race.
Yeah, I mean, she started out as this dynamo who unseated John Mica in the 7th Congressional District.
Extremely surprising
Winter
result.
Park, yes. Yeah. And has really been a champion for the moderate voice. That's what I've seen out of her in Washington. And
yeah, she was one of those blue dog Democrats.
she
on the moderate
was,
side,
absolutely, and really was a kind of a spokesperson for that group. And her district was redrawn, and she didn't run again. And I think, though, the issues she's seizing on are these issues that have absolutely resonated with voters, especially in the district that Winter Park makes up for the county. And she'll have to see if that goes across the board. But I think this last round of county commission elections showed that the zoning issues, the traffic, transportation, those are things on voters' minds. You can tell that by who won and how much they won by.
Yep.
And it was the candidates that were most loudly voicing for change in those areas, including on how the tourist tax is distributed. And a candidate who has been probably the loudest on that won in District 5, but I think that's going to be a huge test for her.
What about the other candidates, Joe Mario? Who else has declared here? What does the current field look like?
Yeah, some familiar faces in there. We have Tiffany Moore Russell, the Orange County Clerk of Court. We have Orange County Commissioner of District 3, Myra Uribe. We also have Chris Messia, a self-described tech enthusiast.
It's going to be a pretty significant election for Orange County and, of course, for the region as a whole. Be sure to find us on social media. Meanwhile, we're at WCF TV on Facebook and Instagram. You'll also find us on X at Newsnight WUCF. But that is all the time we have for this week. My thanks to Giovanni Diaz, Beth Kassav, and Joe Mario Pedersen. Thank you so much for coming in, guys.
Always a pleasure.
Really appreciate your time today. We'll see you next Friday night at 8:30 here on WCF. From all of us here at Newsnight, take care and have a great week.